talking, just kind of kidding in between during the break as you and Chris were coming in studio, kidding about the fact that we've been talking about Obamacare since 2009. That is more than 4 years we've been talking about that, and it's all been bad. We've been ruining the day, and you know when they were pushing for it, talking about how bad it was, and then it was passed, and then we started finding out what was in it. Tell us a little bit of what American Family News has got planned on this subject, and why it's timely.
Well, I tell you what, yeah, we're talking about it for 4 years, and I know, if we get tired talking about it, listeners get tired of us talking about it also. But here's what's important, folks. 2 weeks from today is October 1st, and that is when the so-called Obamacare exchanges kick in. Now, why is that important? Well, the big crux of Obamacare is that it forces everyone to have health insurance. That's kind of the bottom line in all of this. And if you don't, you're going to get fined. Across the nation, these exchanges have been set up. And if you can just imagine for a moment looking at it on the internet, it's kind of like going shopping on eBay. You're going to be given options about where you can buy insurance. And there will be different insurance packages, and Chris is going to talk more about this. What we decided to do and what led to us coming in and chat with you in the studio today is that Chris has been doing a lot of research on this, and starting next Wednesday, he's going to do a 3 to 4 part series on what you need to know about these exchanges. What are going to be the particulars? Because like it or not, you're going to be involved with Obamacare. It is the law of the land.
Right.
And so we've had all the political debate, and the political debate will continue. We know that. But as I say, like it or not, you are going to have to get involved with this law because if you don't, you'll be fined. When you go to fill out your tax return in the spring of 2015 for 2014, if you cannot prove that you have health insurance, they will fine you one way or the other. So that's why it's important. We felt it very necessary in the lead up to these exchanges kicking in on October the 1st, 2 weeks from today. We asked Chris to put together a series of stories for us to help people out and start to see their way through what their responsibilities are going to be under Obamacare.
Well, Chris, give us the good and the bad here. What can people expect? As Fred said, in 2 weeks, October 1st, you are required to have insurance. So what happens on October 1st if a person does not have insurance? Do alarms go off? What happens?
Generally speaking, it basically depends on the person. October 1st is open enrollments. That's the day in which you can go online and pick these health plans. But depending on who you are, what your situation is, male, female, what have you, and in some instances, you may not even have to go to the exchange. We can talk about that in just a minute. But long story short, beginning October 1st, these exchanges will open up. And depending on your situation, you might have to get involved with these and pick out the plan. But depending on the state in which you live, you may not have much of an option in the way of really plans to choose from. Okay,
so I've been hearing over the last several months, for a while really, that some states have opted out of the exchanges.
Correct.
So that means there is not a state exchange that you go to pick an option. So what happens if you live in a state where there is no state exchange?
The federal government, it's written into the law that states that opt not to participate in an exchange, the federal government will operate that exchange for them. There are some very small instances, I don't know the names of the states offhand, but they're doing kind of a co-opt. A state's running half of it and a federal government is running half of it. There will be an exchange where you live. It's just a question of who's running it.
And are they all going to be up and running on time?
That is what the federal government says. There has been a number of questions and reports about maybe data security and whether or not these things, the data hubs is one term you'll hear thrown out there, whether or not those will be ready. And in every instance, someone from the Centers for Medicaid and Medicare or Health and Human Services is generally quoted in an article or television interview as saying these things will be up and running October 1st.
But now one of the things I've been hearing, and since you're kind of our expert on this, one of the things I've been hearing is these data hubs that they're not actually going to be testing the security until the process begins. Is that true?
Yes. There was one story we had last week that said they would be testing them and making sure everything's legit the day before the exchange. So sometime right around October 1st really is when we will get some answer as to whether or not the government really was ready.
So I think the bottom line people have to understand, starting 2 weeks from today, Tuesday, October 1st, you've got roughly 6 months to sign up for these exchanges till the end of March 2014. You have to have insurance in place for at least 9 months next year. So that's why the deadline to sign up for these exchanges. And so, and Chris can go through some of this, but there are whole lots of and, ors, ifs, buts, all of these kinds of things. Depending on your salary, what you make, there could be subsidies for you in place, and these exchanges are supposed to let you know about that. So there's all kinds of things. Chris is going to tell you about what happens if you've got insurance where you work now.
Yeah, if you have insurance where you work now, you most likely will not have to get on the exchanges. You'll keep that insurance. And I emphasize the word now because we don't know what employers are going to do. There have been a number of instances just recently where they've cut staff, they've cut hours. Those might entail or involve you having to get involved with the exchanges. A number of companies, Time Warner, IBM, have moved retirees to exchanges as a means of cutting future expenses, and companies have moved spouses of employees to exchanges, saying we can't cover your spouse anymore.
Ray, do you have some questions? I don't mean to leave you out again. This is just a fascinating issue.
I'm sitting here thinking about our own personal situation because we have, private insurance, not through a company. So does this mean that if you are not employed through your employer, or not insured through an employer, does that mean somebody like me needs to go sign up on October the 1st or sometime soon after that?
Yes.
So no, wait a second. So
that was a clear answer. Good.
Yeah, that's so this shows how little I know about this. So why would he have to sign up? Why would Ray have to sign up on the exchange, which is, I thought, was to purchase insurance if he's already got insurance?
Oh, I'm sorry, I misunderstood him. I thought he said he did not. If you do not have insurance at this point in any way.
You know what I'm saying is I don't have insurance through an employer. My wife and I have private insurance. Do we have to go and sign up on an exchange?
Are we talking about something like a MediShare or Samaritan's Ministry, something like that?
Do you want to share that kind of information, Ray? It's up to you.
No, I just mean we purchased, health insurance from a major company because I'm self-employed for medical insurance purposes. I'd be in the category of there'd be millions of people just like me who don't get insurance from a company, from an employer. So does somebody like me have to sign up on an exchange?
Having said that just now, I would say no. You have insurance and you have something to show come tax time in the future that you have insurance and you are covered.
So really what you're saying is, when you get down to the bottom line, when tax time comes in early 2015, you got to be able to show you've got medical insurance or you're going to pay a fine.
Or that you had it for 2014.
And that you had it for at least 9 months.
Had it for at least 9 months.
9 months in 2014. The bottom line is you have to have some kind of insurance or you'll be fine. That's what's going to happen.
Okay.
Depending on your salary levels, you may be subsidized in the premiums that you have to pay.
But that is only for the exchanges, or would that include someone like Ray?
Oh, that's for the exchanges that you may be subsidized. Listen, Nancy Pelosi said you have to pass it in order to find out what's in it.
Right.
We're still finding out what's in it. Remember, there have been a bunch of exemptions that have been put out there.
Including for members of Congress and their
Isn't
staff.
that nice?
Yeah.
Isn't that nice that they don't have to go to the exchanges, which is a real spur in the saddle, I tell you what, for a lot of folks. These guys pass Obamacare, and then they say, not for us.
Right.
Silly. You taxpayers will take care of us. And that's what's irritating a lot of folks. There is so much to this. Chris is going to kind of break the ice in this series. He's going to start next Wednesday for us, but it's going to unfold over time. I expect Chris and Ed and Ray, we're going to have computer glitches. Mm-hmm. Somebody's going to dutifully go to these exchanges and press that button and it doesn't work. What do I do now? You know, and they're what, navigators or something like that they're called?
Navigators is the term, yes.
Yes, and they're supposed to be able to help you out.
The ones they're hiring right now?
Yes.
In training?
Taxpayer funded navigators.
Well, so that raises an interesting question. Let's say other people out there who are listening or watching online, they don't have their own personal Chris Woodward like we do right now. We can ask them questions. Where do they go for information? Is it these navigators? Is that do they call someone and say, "Look, walk me through this," or is it just strictly an online thing that you know? There's a lot of people out there, surprising number of people who are not computer savvy. This is, and they go online. They may get email. They may go. I'm just thinking of little old ladies that are on Pinterest. That's all. That's the extent of their ability. Who's going to help these poor souls navigate a bizarre, a labyrinth of regulations and procedures?
At this time, it's the navigators that the federal government wants to bring on to help these people find the plan that's right for them. I might also suggest just doing your homework right now in these next 2 weeks, getting on the internet if you can. Go to your local library or someplace that has internet. If you don't have home internet or something at your office. And I might also suggest really just contacting the Department of Health and Human Services either in your state or the federal office in D.C. to try and get some clarification ahead of time so as when October 1st or at some point when you do try to get your insurance, if you have to, you'll have some information and an idea of what things are going to be like.
All right. So now, just to clarify, we're almost out of time here. If someone if they don't have insurance and they have not gone and signed up on the exchanges by October 1st, they don't get fined.
No, the exchanges open up on October 1st.
Right. So they'll have 6 months at that point.
6 months, yes.
I wanted to make sure at the very beginning, I may have given the wrong impression that they had, 2 weeks, it's coming. And so, all right, Ray, you got any other final questions?
No, I'm just sitting here smiling because it's confusing to listen to this. I'm glad we're doing this series with you guys. It's going to be very helpful.
It's going to help. It's a kickoff series. That's what it is, really, to try to explain just the exchanges when we felt we needed to do that. And we're going to parcel out information as best we can to get you through this. We laughed. We said we've been talking about this since 2009. It's just beginning.
Right.
Because people are going to find out a lot of the negatives of the Obamacare. There's that nice sweet pill put out there that you could keep your kids on your insurance program till you're 26. Well, if your kid has gone by that age, that doesn't matter anymore. There's going to be all kinds
What doesn't matter? They can stay on?
No. If your kid is by 26, that benefit doesn't apply to you anymore.
Oh, past it. Okay.
If they're past 26. Yeah. I think what the stories we're going to see over the next several months is, I have to pay a fine. And a lot of young people are just going to say, I'm healthy. I don't want my insurance. And it may be only a $90 fine per year for a young person. I'll take that versus having to pay for insurance every month.
Yeah.
So there's so many more stories to come, and we'll do our best to give them to you.
Well, I'm grateful that American Family News, Chris, I'm glad it's you and not me doing all the research for this. So, folks, keep listening to American Family Association, American Family Radio. We will try to keep you informed as best as is humanly possible on this very confusing issue. So, Fred, Chris, thank you so much for being on the program.
Thank you. You're welcome.
And Ray Pritchard and I will be back in just a few minutes. We'll be talking to Rod Thompson. Why is the IRS auditing adoptive parents? You're listening to today's issues.